A Colon-Rectal Cancer Guide. Chapter 1. A Colorectal Cancer Guide. Colorectal/colon cancer/rectal cancer info 1. The colon is a tube-shaped organ inside the abdomen, also called the large intestine. In the last 15 centimeters of the large intestine, the muscular bands of the colon change into a pouch called the rectum, where waste material is stored before defecation. The main purpose of the colon is the reabsorption of water. When food is eaten, it passes through the stomach, then the small intestines, where nutrients are extracted from it for use by the body, after which it enters the large intestine, which is made up of the colon and rectum, where it's processed as waste, then expelled out the backside. Polyps are abnormal growths in this area which may be benign but could also be cancerous. A doctor can run blood tests and test your stool for the possibility of cancer. Colorectal cancer is the third most common type of cancer among men. The rate of cure is high. Almost all cases of colorectal cancer arise from previously benign, non-cancerous, adenomatous polyps. People with ulcerative colitis are more likely to develop colon cancer. Doctors recommend an annual digital rectal examination for all men 450 and older. The most common screening test to detect colon cancer is the fecal occult blood test, which checks for traces of blood in samples of stool. A more accurate test is called a flexible sigmoidoscopy, a visual examination of the lower third of the colon and rectum that uses a probe with a light and a camera attached. The doctor looks through the viewing tube to check for polyps or signs of cancer. A colonoscopy is a similar procedure that examines the entire length of the colon. The doctor may remove tissue for a biopsy during the test. Another test is a barium enema. Contrast medium, a dye, is inserted through the rectum into the colon, and X-rays are taken of the colon to look for abnormalities. A tumor in the colon is classified by stages, according to whether it has affected only the top layer of the intestinal lining or penetrated farther down into the lining, involved the surrounding lymph nodes and other parts of the body. The only warning sign is if your stools suddenly change and there's blood in them. Treatment may include surgery, radiation therapy, chemotherapy, or some combination of these. Men and women alike over 45 should consider a test for colon-rectal cancer. There are several methods for doing this, either a gloved finger or probe up the rectum, or the patient simply gathers a bit of his stool at home and the doctor inspects it under a microscope. More advanced tests are a sigmoidoscopy, a lighted tube entered into the colon for visual inspection, X-rays with barium enema, genetic screening, or a colonoscopy/proctoscopy/protosigmoidoscopy. A colonoscopy/proctoscopy/protosigmoidoscopy is a procedure whereby a long tube is inserted into the anus up to the colon to look for signs of colon cancer and blood in the colon. Treatment depends on the severity of the cancer. There are 4 stages. Stage 1 means that the cancer has penetrated only the superficial layer of the bowel wall, which is called the mucosa. Stage 2 means that the cancer has gone into the muscular layer of the bowel wall. Stage 3 is when the cancer spreads to the lymph nodes. Stage 4 colon cancer is metastatic, but not all stage 4 cancers are equal. It depends on how many tumors or metastases you have. Once you are diagnosed with colon cancer, the doctor will try to determine the severity of it. He or she will do chest X-rays to see if the cancer has spread to the lungs, then CAT scans to see if it has spread to other parts of the body. Surgery is usually a colectomy or transanal excision/TAE, cutting into your body to remove the cancerous material and part of the colon if necessary. You'll have to rest while it heals. Laser surgery is sometimes used. Chemotherapy and radiation therapy are sometimes used both in lieu of and along with surgery. Some people will never regain their ability to use the bathroom normally again and will need a colostomy, a bag to collect the waste from then on. Eating fibery foods can cut the risk of colon cancer drastically. Colorectal/colon cancer/rectal cancer info 2. Colorectal cancer, or bowel cancer, is common. Most of these cancers are in the colon, large intestine. Some are in the rectum. Common symptoms are a change in bowel habit, constipation and bleeding, mucus discharge, Pain in the lower abdomen. Most colon and rectum cancers are adenocarcinomas. Some of these are mucinous, which means protein in mucus. There is a genetic predisposition to colorectal cancer. Diet has an influence on the incidence. Eat fibery foods. Animal fats increase risk. Colorectal cancer develops from benign polyps, a tumor on a stem on mucous membranes. The risk increases with age. This is cancer of the colon. Certain body cells in the colon do not function normally. They divide very fast and produce excessive tissue which accumulates as a tumor. The colon and rectum together complete the process of digestion. Cancerous growth in the colon is colon cancer. Cancerous growth in the rectum is rectal cancer. Together, they are termed colorectal cancer. In the early stages, there are hardly any symptoms. Common symptoms include abdominal pain, blood in the stool, unexplained weight loss, changes in bowel habits, iron deficiency anemia, excessive tiredness. Factors that may encourage colorectal cancer. Diet rich in refined products and many sugary products, you have a higher risk of contracting colorectal cancer. Menopause could cause cancer. Family history of colon cancer. Lack of physical activity. Obesity. Hormonal replacement therapy for menopause problems can reduce risks of colorectal cancer. Intake of regular calcium supplements, lots of fresh fruits and vegetables and a diet rich in fiber can reduce colorectal cancer risks. Common methods for diagnosing colorectal cancer include colonoscopy, every 10 years. Sigmoidoscopy. Fecal occult blood test, yearly. Barium enema, every 5 to 10 years. A barium enema test requires injection or ingestion of barium, which then settles as a lining in the colon wall. This helps in getting a clear picture of infections, tumors, and other abnormal growth in the colon. Doctors check for hidden blood in stools through fecal occult blood tests. Colorectal cancer in the early stages is often curable. Estrogen replacement therapy, common among menopausal women, is a therapy. Drink lots of water to help reduce the incidence of colorectal cancer. Stay away from red meat and other animal fats. Eat legumes, fish, poultry, and whole grains. Detection and diagnosis of colon cancer is done through the following processes. Colorectal/colon cancer/rectal cancer info 3. This is a cancer of the large intestine. There is a cancerous growth in the colon, appendix, and rectum. It starts as a benign growth in the colon, some of which turns cancerous later. Symptoms may include change in bowel habits, like constipation, diarrhea, or it could be a feeling of retained stools. There could be a change in quality of stools, such as narrower stools and stools with mucus. Stools with blood in them. Regular rectal bleeding. Reduction in fecal caliber. Extreme weakness and tiredness. Excessive weight loss for no apparent reason. Feeling anemic with palpitations, dizziness, and low levels of hemoglobin. Vomiting and abdominal cramps. Abdominal gas, bloating or fullness. Colorectal cancer often affects people over 60. There could be a genetic factor. If you have adenomatous polyps, you have a higher than average risk of developing colon cancer. Having an ulcerated colon can increase the chance of colon cancer. A diet rich in red meat, low in fresh vegetables, fruits, fish, high fiber foods, and poultry may increase the risks of colon cancer. Men who smoke have a higher chance of contracting colon cancer. Absence of regular physical activity can increase the risk of colon cancer. Alcohol consumption may increase the risk of colon cancer. It is not possible to detect colon cancer in the early stages. Colorectal cancer develops over a long period. Tests can help doctors detect its presence. Fecal occult blood test. Doctors conduct this test to detect blood in stool. Digital rectal exam. Doctors insert a gloved and lubricated finger into the patient's rectum to feel for abnormal growth. Endoscopy, could be a sigmoidoscopy or a colonoscopy. Sigmoidoscopy consists of inserting a lighted probe, a sigmoidoscope, into the rectum and lower colon to check for any abnormalities or polyps. Colonoscopy refers to inserting a colonoscope into the rectum and the whole colon to check for any abnormalities. PET imaging of the whole body. This test can provide an accurate evaluation of the presence of tumors and the extent of the spread of disease. Stool DNA testing. Premalignant adenomas and cancers do not degrade during the digestion process and remain stable even in the stool. Such testing, in combination with polymerase chain reaction, can help to detect the presence of colon cancer with a high rate of accuracy. Colorectal cancer is sometimes curable in the early stages. Common treatment options include surgery, chemotherapy, and radiotherapy or a combination of all of them. In advanced cases, it is necessary to remove a section of the colon that contains the tumor to reduce the possibility and extent of recurrence. Curative surgery involves total mesorectal excision. Doctors prefer a proximal fecal diversion through bypass surgery if the tumor affects other adjacent organs in the vicinity. Laparoscopic assisted surgery can reduce size of incision and thereby minimize risks of infection. Chemotherapy can shrink the tumor or slow its growth. This is the primary form of therapy if colon cancer is in the initial stages. Radiation therapy is not commonly used with colon cancer. It might cause radiation entrythes. Colorectal, bowel, cancer websites. cancer.gov/cancer-topics/pdq/treatment/colon/patient, colon-cancer-treatment.cancer.gov/pdq/treatment/rectal/patient, rectal cancer treatment. cancerresearchuk.org/cancer-help/type/bowel-cancer, bowel cancer. Colorectal cancer. cancerresearchuk.org/cancer-info/cancerstat/type/bowel, bowel. Cancer statistics. cancer.gov/cancer-topics/wintk/colon-and-rectal/page 1, what you need to know about cancer of the colon and rectum. youtube.com, bowel cancer. aicr.org.uk/bowel-cancer-faqs.stm, bowel-cancer-faqs.bowel-cancer-uk.org.uk, bowel-cancer-uk.cancer.gov/facts/cancer-advances-in-focus/colorectal, cancer advances in focus, colorectal cancer.medicinenet.com/colon_cancer/article.htm, colon cancer, colorectal cancer.colliance.org, colon cancer alliance. listserv.acer.org/script/wa-acor.exe?a::colon, Colorectal cancer discussion list. royalmarsden.nhs.uk/cancer-information/types/pages/colorectal-cancer.aspx, colorectalcancer.colostomyassociation.org.uk, colostomyassociation.magnolia-foundation.org, Magnolia Foundation. ncbi.nlm.nih.gov/pubmed?term $colorectal cancer. cancer.gov/cancer-topics/pdq/treatment/colon/health professional. Colon cancer treatment, information for health professionals. cancer.gov/cancer-topics/pdq/treatment/rectal/health professional. Rectal cancer treatment. cancerresearchuk.org/cancer-info/cancerstat/types/bowel, bowel. Cancer statistics. evidence.nhs.uk/topic/colorectal-cancer, colorectalcancer.patient.info/doctor/colorectal-adenocarcinoma.htm, colorectal cancer. foscrs.org, American Society of Colon and Rectal Surgeons.oncolex.org/n/colorectal-cancer, cancer of the colon/rectum.correcto.com Spanish language. pathways.nice.org.uk/pathways/colorectal-cancer, colorectal cancer, clinical pathways. seer.cancer.gov/statfacts/html/color-ct.html, seer stat fact sheets, colon-and-rectum.cap3.org, cap3 cancer prevention study.cancer-institute.org.au/data-and-statistics/cancer-registries/hereditary-cancer-registry, hereditary cancer registry, nsw.hopkins-cancercenter.org. Insight-group.org, International Society for Gastrointestinal Hereditary Tumors. cancer-genetics.org/x031.htm, gene and chromosome. Abnormalities, Cancer Gene Web. Anal cancer websites. Anal cancer is not common. Malignant cells are in the anus, otherwise called the asshole, both the rectum, the outside, and the anus, the inside. cancer.gov/cancer-topics/pdq/treatment/anal/patient/page 1, anal. Cancer, information for patients. cancerresearch.uk.org/cancer-help/type/anal-cancer, anal cancer. cancer.net/cancer-type/anal-cancer, anal cancer. macmillan.org.uk/cancer-information/cancer-type/anal/analcancer.aspx, analcancer.ncbi.nlm.nih.gov/pubmed ? Search PubMed. Database for anal cancer. cancer.gov/cancer-topics/pdq/treatment/anal/health professional/page 1, anal cancer treatment, information for health professionals. patient.info/doctor/anal-carcinoma.htm, analcarcinoma.oncolex.org/n/anal-cancer, cancer of the anal canal. startoncology.net. seer.cancer.gov/statfacts/html/anus.html, seer stat fact sheets. Anal cancer. Colon cancer associations, organizations, websites. ccalliance.org, Colon Cancer Alliance, CCA. Patient organization. Colorectal-cancer.net, Colorectal Cancer Network, CCN. nccra.org, National Colorectal Cancer Research Alliance, NCRA.